Do you know what is the most functioning joint in the body? It is not the knee joint, it is not the shoulder joint. It is TMJ. TMJ is nothing but temporomandibular joint. It is the jaw joint which connects your lower jaw to the skull. It helps you to open and close mouth. Hi, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon, Care Hospitals. TMJ is a very mysterious joint. Often people suffer with temporomandibular joint problems, but yet they don't know whom to approach, what to do, and how to get it treated. We have seen patients who had a TMJ problem, but yet they mimics like a ear pain, and hence they consult ENT surgeon. Now ENT surgeon examines ear and says no problem in the ear. Now then they go to a dental surgeon thinking that it's a dental problem. Dental surgeon examines the teeth and says no problem. Now the confusion increases. Then they go to a neurologist thinking that it's a headache. Neurologist does all the relevant investigations and says everything looks normal. Now here is the confusion. What is this problem and whom to refer or whom to consult to treat this temporomandibular joint disorders? Trust me, we have seen a lot of patients confused, taking medicines, thinking that it is something psychological problem. But it is not true. Temporomandibular joint pain occurs at a very young age. It starts with a clicking sound, especially when you start trying to open your mouth. Gradually, it starts with the pain, and gradually the pain increases. Now, this pain refers to your head, ear, neck, and shoulder. And the pain is so severe that in the later stages, the patient will not be able to open the mouth. So, this pain is called as temporomandibular joint pain. Now, how to diagnose yourself? Try to put your fingers in front of the ear and try to press and see for yourself. If you have pain, that is temporomandibular joint pain. What happens if someone has got a temporomandibular joint pain? As the pain progresses, the joint gets eroded. That will lead to temporomandibular joint arthritis. Now, do we have a treatment for this? Yes. If you consult a surgeon who has expertise in temporomandibular joint, initially they will ask all your history. What is the cause which is causing temporomandibular joint pain? Especially if you are a very hard chewer, especially if you have a habit of clenching your teeth, and someone who has got lack of sleep, stress, anxiety, very difficult irregular work patterns. These are the common causes which causes temporomandibular joint pain. Now, if you consult a temporomandibular joint surgeon, they will evaluate clinically, ask your history, and then they may subject you to a series of investigations which includes MRI of the TMJ. MRI shows the internal parts of the temporomandibular joint, especially the joint functioning when you try to open and close mouth. There's something called as disc which acts as a cushion in the temporomandibular joint. Now this cushion will sometimes get deranged, and that is where the patient gets a pain. This pain radiates to the ear and head and neck region. Now, as a TMJ surgeon, we try to look at the disc and see where is the position of the disc. If disc is displaced in the front region, then we try to manipulate the disc doing a small arthroscopic surgery, which is a very minimally invasive surgery, and try to reposition the disc. That is where the disc is preserved and the pain is gradually reduced. Are there any medical treatments for temporomandibular joint? Yes, we do have some medicines to treat the temporomandibular joint disorders. But in a very early stage, instead of doing a surgical procedure, we try to give some medicines to relax your muscles, to try to put the disc in the back position so that the pain is often relieved. If the pain advances to a next level, that is where the medicines doesn't offer you a help. That is where your temporomandibular joint surgeon needs an intervention doing a minimally joint procedure. How is the recovery after temporomandibular joint surgery? Recovery is usually fast. Within a day or two, the patient can go back home. The patient can go back to his normal work and start chewing immediately 6 hours after the surgery. Is the results are long lasting? Yes, the results are very successful and long lasting. Do they get the pain again? Most often, if they correct their lifestyle, the pain will never reoccur. But if the joint itself is damaged, then there is a possibility of the temporomandibular joint pain reoccurrence. So that is where it is very crucial to know that early diagnosis will definitely save the temporomandibular joint. So next time, if you feel that you have a temporomandibular joint, do consult a maxillofacial surgeon who is expert in TM joint surgery, that is temporomandibular joint surgery. So we're always happy to help the patients who has got temporomandibular joint and give them a permanent relief. If you find this information very useful, please try to share it with the friends and family members who are having this temporomandibular joint problem but yet clueless whom to consult. If you find this information valuable, please like this video and share with your family and friends. Thank you.